Hello. Just a minute. This is a little unusual to do both the live audience and Teams, so forgive me if I don't know where to look. Thank you. Thank you. My name is Angelica Nikolowitz. I'm a program manager at the Office of Supportive Housing, and I have two other managers with me today that will go ahead and introduce themselves. I will step back over.
Hi, I'm Christine Caldwell, another program manager at the Office of Supportive Housing. Also don't know where to look.
Hi, I'm Christina, and I'm also one of the program managers at the Office of Supportive Housing with the intensive case management team. So I'll move it to Angelica, who will begin our presentation.
All right. Okay, so welcome again. Thank you for attending. So I work for the Office of Supportive Housing, and actually, it's a big division. Office of Supportive Housing is also known as OSH. We do many things that I will not be able to cover in this presentation. But we'll be talking about some of the direct services we provide and the population that we serve. So before we begin, I'm going to be giving you some statistics about homelessness in Santa Clara County. So the population we serve is a very visible population. We see the encampments by the freeways. We see folks sleeping on the streets, in cars and RVs. Homelessness has become a political issue as well. And no one feels like it's getting better, and everyone thinks they have the best idea on how to solve it. And so today we're just going to share what we do and some statistics. So this is a graph indicating the homeless point in time count. So this is a HUD requirement. The Department of Housing and Urban Development requires our department to take account of the homeless population. It's done every 2 years. As you can see on the top graph, homelessness is on the rise from 2015 to 2022. You can see that homelessness is growing. And the statistics on the bottom indicate the numbers separated by those who are living in the street and those who are in shelter. The Office of Supportive Housing works with partner agencies to complete the point in time count. The last count was in January of this year, and we do not have those statistics yet. This is a very interesting PowerPoint. So there's a lot of effort to, help the homeless, get people in housing. But unfortunately, for every individual and family that we serve, there are 1 or 2 households experiencing homelessness for the first time. So I wanted to also let you know, one of the things our department does is we work on homelessness prevention, and we have a lot of financial assistance programs that are working to keep people in their housing. So like I said, we do many, many things that I cannot cover, but I'm going to share some of the things that our department does besides supportive housing or in different capacities. So this is a PowerPoint kind of indicating a lot of the roles the Office of Supportive Housing has. I'm going to be really focusing on supportive housing operations, system management, and also the service provider column. And this PowerPoint will be shared or already has been shared, so feel free to look over it again. One thing that's been new for our office is the mass care and sheltering. The Office of Supportive Housing has been tasked with providing or spearheading emergency preparedness for any disaster that occurs in our community. So we'll be working with stakeholders to provide emergency services And that kind of came out of the pandemic response that OSH was doing. We did a lot of work during COVID-19 pandemic when everything was shut down. Like many of you, we were essential workers continuing to come to work. We were tasked with supporting the unhoused population during COVID-19. You know, a lot of us didn't know what was going on in the beginning. So we developed pop-up shelters. If you guys remember the mass sheltering that occurred, there were many pop-up shelters that we were working to get folks into, and also quarantine motels. If folks were having to quarantine or isolate, we set up a system of motels for folks to be able to do that in. And this is, again, another snapshot of the work we do. This really focuses on the service side of all the different divisions within the Office of Supportive Housing. Again, I will be focusing on the coordinated assessment system or the coordinated entry system. We'll talk about interim housing, and then I'm really going to focus on permanent supportive housing because that's Christina and I, that's kind of our jam. That's what we do with the Office of Supportive Housing. All right. So we're going to begin at the beginning with the coordinated entry system. And so this system is a process for clients to access resources if they're experiencing a homelessness crisis. It's a way for people to access our system. And again, a lot of the work we do, because we get a lot of HUD or federal funding, a lot of the systems we set in place are due to HUD requirements, and the coordinated entry system is one of the requirements. And so it's a way for us to streamline services and have one entry point for clients who need support, who are either at risk of homelessness or are homeless. And so we will be talking about access, assessment, prioritization, and referrals in this presentation. Okay, and another reason we have the coordinated entry system is that there isn't enough housing. You know, if the point in time count shows 10,000 people homeless in our community, we do not have enough housing resources to support them. So the coordinated entry gives us a way to prioritize the most vulnerable individuals and families. And that is really the main point of this. We want to be fair and equitable. So we came up with this system. So I'll be talking about access, which is the actual entry point for clients entering our system, and how we prioritize. So this screen depicts how folks get connected with our system. We have a lot of partner agencies that are able to get people into our system. In a minute, I'll be talking about the VI SPDAT. I'm sure that's something you may or may not have heard of, but that is an assessment tool that is part of this access and entry system. If you haven't heard of it, the Here For You call center is a new shelter hotline that the county is supporting. People can call the hotline to get referred to shelter services or to find out where they can do the assessment tool if they feel they qualify for housing. You can see one of the places people can access is our HMIS partner agencies. HMIS is a data system that we use at the Office of Supportive Housing, and all our partner agencies use HMIS. It stands for Homeless Management Information System. And at the end of this slide, there will be resources of who our partner agencies are and where they can go. So I liked this quote. Deborah Townley is actually a permanent supportive housing client. And she states, if affordable housing is the boat's rescuing Titanic passengers, the coordinated entry system is the method for triage that decides who gets a seat on a lifeboat. So that's a good comparison to what the coordinated entry system is and how we're trying to triage those folks that should be connected to a housing resource. So the VI SPDAT, I can't see you in Teams land, but I'm sure a lot of you have heard of it. Some of you may be doing the assessment tool out in the community. The VI SPDAT, the actual name is Vulnerability Index Service Prioritization Decision Assistance Tool. It is a mouthful, so now you know why we call it the VI SPDAT. But even the VI SPDAT is a mouthful too, because a lot of people, if they don't know what that is, they don't know what you're saying because it sounds kind of odd. But anyway, so it's an assessment tool. It's also known as a survey. Some agencies refer to the VI SPDAT as a survey. So it is a self-report assessment tool. So those that are trained to do the VI SPDAT will be meeting with clients in the community, asking them the questions that are part of the VI SPDAT. And, you know, we're not asking for a lot of information from clients. Again, it's self-report. So clients are either asking, you know, basically with one-word answers. So who is eligible to do the VI SPDAT? It is intended for homeless households, not for households who are at risk of homelessness, but those who are actually experiencing homelessness. That is the intention of the VI SPDAT. So if you are working with a family who's at risk, they should be routed to prevention services or an emergency assistance resource where they could get financial assistance to potentially keep the housing that they currently have. In permanent supportive housing, households should meet the HUD's definition of homelessness when they're doing the VI SPDAT. And I will be talking later about the HUD's definition of homelessness. We'll go into that a little bit more. So there are numerous versions of the VI SPDAT. It was originally the single adults VI SPDAT, which is intended for adults age 25 and older with no children. We have a family VI SPDAT, and so this is for households who have a minor child. And it could be like a sibling, you know, as an older adult sibling with a minor sibling, that is considered a family. We also have a VI SPDAT version for transition age youth, and these are individuals 18 to 24, and for unaccompanied minors. And we also have a VI SPDAT version for clients who are exiting jail or prison. And the questions are just kind of geared for the potential risks or vulnerabilities of that population. So we wanted to be able to capture everyone's risk assessment. All right, so I have a few people in the audience who has done a VI SPDAT. Okay, so 3 people. All right, so you are familiar with it. So these are the domains of the VI SPDAT. And just to let you know, we have a work group that is actively working and re-examining the VI SPDAT. We want to make sure that we come up with an assessment tool that is capturing the information that we need in order to support our clients in the community. So the domains of the VI SPDAT are history of housing, risks, socialization and daily functions, and wellness. Again, this is self-report. I know several years ago, it's been a while, I would do VI SPDATs, and what I often found is that a lot of clients don't want to disclose all the experiences that they're having. So they're trying to change the VI SPDAT to have staff contribute to it, to kind of share their observations. So we get a good picture of a client's vulnerabilities. So we're looking at how long they've been homeless, risk of harm to self or others, if they are high risk or in exploitive situations, how often they interact with emergency services. I mean, a lot of the point of supportive services is reducing emergency services and the cost that is associated with them. So are clients going to the hospital a lot? Are they going to EPS a lot? Are they in and out of jail? Do they have a lot of legal issues? And then we're asking questions about their ability to care for themselves. Can they manage their activities of daily living? Can they manage their own funds and money management? Do they have meaningful daily activities? And then we get into wellness and try and get a history of their mental health, their cognitive functioning, their medical, how are they doing with their health? We ask questions about medication, substance use, and experience of abuse and/or trauma. So now we're going to dive into the community queue, prioritization, and referrals. So the community queue it basically prioritizes people who have completed the VI SPDAT. It's used to fill spaces in housing programs such as permanent supportive housing, rapid rehousing, and transitional housing. The community queue is managed by the Office of Supportive Housing, and I'll talk about that a little bit later. The community queue is not a waiting list. There's a lot of misinformation that is in the community about VI SPDATs and what it means, and everyone wants to get on this wait list, but it's not really a wait list. The community queue is a pool with prioritization continually in flux as new assessments are completed. And that's the part that a lot of people don't understand, is that it's, clients are entering the community queue and they can get a high VI SPDAT score, which would make them eligible for housing. But there could be 10 more people assessed that same day with higher scores that are going to push that client down. So the community queue is constantly changing. Because I think one of the common questions, clients will ask service providers is like, how long will it be to be housed? And where am I on the community queue? And then lastly, referrals are made from the queue to the permanent supportive housing, rapid rehousing, and transitional housing programs. Okay, so OSH manages the community queue. It's a big job. The person who manages the queue is called a matchmaker. So essentially they are looking at the clients in the community queue and looking at available housing services and matching them. Permanent supportive housing clients, those who fall in that range when taking the VI SPDAT, have the highest acuity level. Those are the folks that need permanent help. Because of their vulnerabilities, whether they have a medical condition or other things. Rapid rehousing and transitional housing, the acuity level isn't as high. Those are short-term rentals for families or individuals who just need maybe a couple of years of support, and with the hope that they can manage on their own and keep their housing. Okay, so what coordinated entry is and is not, it's a way, it's creating one direction to supportive housing for everyone. So everyone, it's one system, you get to an access point, you do the VI SPDAT, and if you have a certain score, you'll be added to the community queue. It allows us to prioritize, and it takes time. So some of the things the coordinated entry is not, it does not guarantee housing. It doesn't create more housing, and it does not place people on a waiting list for housing. So normally what we tell folks who have taken the VI SPDAT is that while they're waiting, they should continue to work with their service provider on whatever needs they have at the time. And right now, these are the 3 programs available to those going through the coordinated entry system. As I mentioned, permanent supportive housing is permanent. You know, if you're able to, you're going to get a rental subsidy for the rest of your life, and you're going to have case management for the rest of your life. Rapid rehousing is a short-term rental up to 2 years, with the goal of having that family or individual take over the housing once the program ends. And then transitional housing is similar to interim housing, help provide support until they move to permanent housing. So I have a couple of slides to share with you. This is on our webpage, the Office of Supportive Housing webpage. So it's a good depiction of our system, where you'll see on the far left the possible access points. So these are the areas where clients can access services. These are the entry points of our system. They're going to take the VI SPDAT, and it's going to be entered into HMIS. And then it will be determined where they fall. What is their vulnerability index? Are they in the permanent supportive housing range, rapid rehousing? We also have folks who score very low, so we're referring them to other services to help with income or financial assistance. And here's some data on the number of VI SPDATs that we have done from 2015 up to 2022. Almost 50,000 VI SPDATs we have completed. And of those, 31,000 are unduplicated assessments, because there are certain situations where clients can take a VI SPDAT over again. But you can see, you know, the primary population that we are serving are individual adults by a long shot. We've recently had some housing subsidies that were able to help a lot of families recently. These figures probably aren't as accurate, because I feel like our families are much lower. And this talks about the assessment score, which you'll see on the far left, and how scores are correlated with the different ranges. PSH range, and that's about 37% of our assessments that we complete. Rapid rehousing is the majority of the assessments we complete at 48%. And then there's the small percentage of minimal intervention. And I like this slide because it's just a very simple map of what our coordinated entry system is, where you start at the beginning to connect with a service provider. You take a survey, which is currently the VI SPDAT. The survey is entered into HMIS for the community queue. When a supportive housing resource becomes available, then the matchmaker from OSH will pull that person from the community queue. And then that client will have contact with the client engagement team to help them collect and go through the intake process. And if everything goes right, then that person will move into housing. So we're going to talk about the client engagement team. I wanted to give a little bit information because the client engagement team lives at OSH. They are a team of very hardworking individuals. And so I wanted to give you a little bit of information about the team and what they do. So the client engagement team, also known as CET, are county employees, and they work at the Office of Supportive Housing. The CET is made up of rehabilitation counselors and mental health community workers. And the CET team, again, is their first contact with people being pulled from the community queue. CET will pre-screen individuals before moving them forward in the permanent supportive housing intake process. So this system, this team works with those folks that qualify for permanent supportive housing services. So I'm really going to be focusing on that for the rest of this presentation, because that's something we're all very familiar with and very passionate about. So here is the HUD eligibility for chronic homelessness. Any client who needs to go through the screening process for permanent supportive housing services needs to meet the HUD definition of chronic homelessness, which is being homeless for 12 or more consecutive months, or having 4 episodes of homelessness in 3 years that equal 12 months. There are certain criminal convictions that will bar people from moving forward in the PSH process, and I'll be sharing that information a little bit later. If someone has been incarcerated or in an institution for more than 90 days, they are considered housed. And every permanent supportive housing client must have a documented permanent disability. So those are the main criteria for this program.
Can I ask a question?
Yes.
Do you know why the third rule exists?
A lot of the protocols or policies are coming from our HUD funding stream. So we have HUD, and we also work with the COC, which is part of a group of folks who manage HUD funding and programs. And so that is one of the regulations of permanent supportive housing. Even when a client, I'll go a little off topic, even when a client is in their housing unit and say they get arrested and they're going to be in jail for a year, they will no longer qualify for permanent supportive housing because they'll be absent from their unit for more than 90 days. And that's something that certainly happens. So again, here's a little bit of information more about the CET intake process. So like I said, we start with the homelessness and disability verification. Not only does the client have to meet the HUD definition of chronic homelessness, but we have to verify that they were actually homeless. So what we do is we do a homeless timeline, and that's part of the work of our CET team.
In the previous slide, we have somebody on Zoom saying regarding documented disability, who does it need to be documented by?
A licensed medical professional for the verification of disability. And so disability. So the good thing about this process that we created, we've partnered with the Valley Homeless Healthcare Program, otherwise known as VHHP. And in this partnership, VHHP established a clinic called Hope Clinic that is geared just for our permanent supportive housing clients. So we were able to streamline a system when we have a client going through the intake process and they're ready to get their disability verified. We work with the clinic to have clients go into the clinic, meet with the doctor, and complete the verification of disability form. Once those 2 verifications are completed, then the client, with the help of CET, is applying for an eligible property. So we have a lot of properties that we work with. And so this is part of the job of the matchmaker, matching folks with properties. And so the CET team will look for eligible properties and help the client fill out those apartment applications. And if the client passes that application process, then they move on to applying for their subsidy. Because permanent supportive housing services, you get case management, but you also get a rental subsidy. So the client is applying for either a housing authority rental subsidy or a subsidy through abode services. If we have, yes.
Someone asked, do they need to be a citizen or can any person apply?
Yeah, I'm gonna get to that in a second. I will cover that. Thank you for asking. I still don't know where to look, sorry, everyone. So if a client has no income, because a lot of our clients do not have income or they just have general assistance, we will connect them with our Housing and Disability Advocacy Program, otherwise known as HDAP. We have a lot of acronyms at OSH. And so this is a program that will help clients apply for Social Security. So they'll either be linked to a Social Security advocate or an employee of HDAP will be that advocate to help the client through that process. And then something new for our department is interim housing. So, you know, we have 2 sites right now, Bella Vista and Willow Glen Studios, otherwise known as Pedro Street. So these are 2 sites. So as we have clients going through the intake process, if we have availability at interim housing, we will place clients there. So it gives them a roof over their head, a place to live. They get support services from staff on the site. And it makes it easy for the clients to get organized, get used to living indoors. So that's been a real exciting part of our supportive housing system. And then again, if everything goes right, they will be approved. Okay, so I am going to jump into permanent supportive housing and what kind of services a client can expect once they're through the approval process and they'll be moving into their new unit. The main goals of permanent supportive housing is housing retention. That is the #1 goal. You ask any permanent supportive housing case manager, and that will be the first thing they say. We don't want our clients to lose their housing, so we're going to work hard to make sure they keep their housing. Another goal is reduce service utilization. You know, the hope is that once they're housed and stable, they will stop going to the hospital and EPS as much. And of course, wellness. You know, we want our clients to feel safe, to have a stable environment, and to just focus on their health and wellness. A lot of our clients, because of their disabilities, are not able to work. So we do try to connect them with some other benefit besides general assistance because it makes it difficult for them to pay rent. The principles of PSH is housing first, harm reduction, and we have a do whatever it takes philosophy. Housing first, those of you who are not familiar with it, it's really one of our guiding principles. We don't have, you know, if a client gets through the eligibility process, really nothing is going to prevent them from being housed, even if they're actively using substances, they have untreated mental health symptoms, we're still going to house them because we see housing as the intervention. And with that, we work with a harm reduction model. Some of our the subsidies that we provide, there are 2 types of subsidies that clients could obtain. We have we call them project-based vouchers. So these are clients who the voucher is really attached to a property, and the client will move to that specific property and be able to live there permanently if everything works out. And there's like a whole about other stuff about these vouchers, but we don't have enough time. Housing choice vouchers is a more flexible voucher. It allows clients to live in the community and rent from private landlords. And like I said, clients will get case management and clients will be signing their own lease. So they will be the tenant. And so what is the connection between supportive housing and behavioral health? So clients have access to specialty mental health through their housing provider. They do not have to go to the call center. All our service providers have licensed clinicians on their staff, so they're just self-referred within their own program. So it makes it very convenient. The clinical services are provided out in the community. There is really no clinic. So it's more convenient for our clients. And because of our partnership with VHHP, our clients have access to psychology and psychiatry. So we're going to talk about some of the resources our clients get, and I'm going to hand this over to Christine.
All right. I don't know where I'm looking, so I'm just gonna look at these. So some of the resources that we provide for clients once they move in are financial assistance. And that's usually around, they're following, when we're housing them, they're regular tenants living in our property. So they have application fees, security deposits, and first month rents. That's the expectation once they get into housing. So there are financial assistance programs that we have to make sure those things are covered, because we're aware that clients won't often have that money up front. So we make sure that part is taken care of. We also provide for every new client that is housed, whether they're in a scattered site program, whether in a project-based voucher within our properties, that they have furniture, which includes beds and dressers, dining tables, couches, and chairs. So it's a full kit. I manage all that. There's also within that the furniture kit, there's welcome home kits, and the welcome home kits are sort of to kind of give all the stuff that's in there, that's for their unit, like their flatware, their cooking stuff, make sure they have cleaning supplies, make sure they have bedding and towels, make sure they have a plunger for their toilet. Very important, very important. And then again, one of the other reasons having the service provider that's usually on site or working closely with the clients is to make sure that the clients themselves pay 30% of their income for their rent. So that nobody has zero rent. So if you have zero rent and you're with the housing authority, your rent's $50. So the idea is to connect them with some sort of income so that they are able to pay their rent on time. Okay, housing retention, also my jam. So the expectation is that 90% of our clients will remain housed for 12 consecutive months. I think we do pretty well on that. So part of the things that their support is, again, they have a case manager, they have harm reduction specialists that will work with the clients, pretty much assisting them with making sure they're paying their rent, making sure they're following their lease, making sure that their units are cleaned, basically teaching them how to live indoors again. The case managers work with their clients if there's any issues with their property managers or landlords. So the idea is that your client's having a hard time, you're going to reach out to the property manager and see if you can figure out like a way to make sure that housing can remain intact. Within our office, within the properties that we work in, we also provide monthly meetings. That's actually meetings that I do. And the idea is that we kind of knock out, hey, what are the issues that people are having? How can we fix this? If it's about rent, we work together to solve the problems. So the idea is, again, like we all work really hard to make sure that we can hit that 90% at least. And supportive housing developments. As I said, we have grown quite a bit over the last, since 2015. So here's a slide that sort of shows you that there's 2961 total units since 2015 compared to 250 units before. So wanted to give you also a little bit on our pipeline. This is one of our new properties, Villas on 4th. It's 100% building of PSH folks. So in that, it's also a senior property for folks that are 55 years older. There's 93 studios in 1-bedroom units, and that's right downtown on 4th Street. You might see that building. That's leasing up in June. So 2 weeks, actually. I heard that that's coming up real quick. Emmanuel Sobrato is a mid-Penn site, also permanent supportive housing, 100%, 106 units, and this is for singles and family, and that's leasing up in early July. Both of these programs have on-site teams so all the case management, the clinical folks, property management team, they're all in that building. So clients are living there and their teams are all on site. So it's pretty convenient to have that all in one place. You got no reason to not see your client. You're basically living there with them. So
Where's that one located?
Emmanuel is over by, it's San Jose City. That's right, San Jose City College. You might see it if you're driving on 280. It's the cool building on the side, on the left. Okay, and then I'm going to hand it off to Christina, who's going to talk about some of our success stories.
Hi, so how I said before, I'm the intensive case manager, program manager at our office. So I wanted to share a little success story. And we have many, so it was very hard to pick, but we had a recent one, so I'll share that one. So we have a male client who has history of chronic homelessness. He's a senior. He had an alcohol use disorder, medical conditions, wheelchair bound. A lot of our clients, because they are living outside, they don't have easy access to support or any issues with handle their medical. So obviously he was homeless for many, many years. So it was very hard for him to adapt to housing. He was often intoxicated, unable to complete his ADL. So those are taking care of your hygiene, making sure you have food, housekeeping. So it was very, very poor. At this property, we actually have case management on site. So they did whatever they could to help this client from the beginning. They would meet with them consistent, provide support, assistance with paying rent. We did do the move-in kit in the beginning. They got furniture. We try to, help them, meeting them weekly, introducing new people to them so they can feel part of the community. After many, many attempts, they started building trust. For us, it's very important to build rapport with our clients. It's not an easy one-day thing. It takes a lot of time. So after that, we were able to connect them to an IHSS worker, which is an in-home support service provider. That it's an individual that helps them clean their unit, take them to appointments. This actual individual has other medical issues. So this individual, the IHSS worker, will get them food and things like that. They also started engaging with the community, which is very important, which meant that it allowed us to have a medical provider. So we connect them to a private at the Hope Clinic. We connect them with the provider. Through that, we also, help them with their hygiene improvement, their cleanliness. We did like a ADL chart for him, this case manager, and we had two case managers at this property who worked with creating this calendar for him so he would able to educate. And now he's doing really well. He's been there for 3 years. He has retained his housing, has no longer any lease violations. He's not, he has no issues. His health, he does have health issues, but he's connected to someone. His alcohol use actually minimized. He was a daily drinker. Now he's only one day drinker, like one at a time instead of constant. So he's no longer intoxicated. He feels like he's part of a community. He advocates for everyone. We have town hall meetings at this property. He's like the first one there advocating for everyone. He's actually very happy that we were able to share his story. Again, this is someone who thought he was never going to have housing, has housing, was struggling. We used all the things Angelica talked about, harm reduction, linking them to services, the Hope Clinic. We actually have some doctors coming to properties, meeting our clients in person at their home. So we are trying very hard to stop those barriers. So this is how we know that housing first is working. So I'll leave it to Angelica for the next one.
Hello again. Thank you, Christina and Christine. I did forget to mention that one of the really great things about having this partnership with VHHP, we're working with their medical doctors, their nurses, psychiatry, psychology. So at our 100% properties, VHHP will go there on a regular basis. They work with a medical doctor, will come on to those sites once or twice a month. There's a public health nurse that works with an occupational therapist that also goes on these sites. So it's a really cool partnership. We're really proud of it. And like Christina said, I'm so sorry. She said that this particular client who I know, and I mean, that is a true success story. We did not feel he was going to do well on the property. And 3 years later, he is doing really great. And it's helped to have doctors checking on him on a regular basis. Anyway, so this is something I am super excited about, even though it's not even my department. So one of the things we're trying to do at OSH is really improve our own system internally in getting people into housing, doing intakes, being more time efficient with this process. So this is a pilot that started at the end of 2021. And it was developed, like I said, to increase the number of intakes. So the CET team is still the first contact with the client once they're pulled from the community queue, but we now have 2 or 3 staff that we call pre-screeners, and they are part of the client engagement team. So they are the first contact and they're asking clients 4 questions. And if the clients answer the questions adequately, they're going to be moved through the system. So someone was asking previously about some of the eligibility criteria. So the questions that are being asked, if the client has a sex offender status, if they do not qualify for permanent supportive housing. If they have certain things on their record, which would be producing methamphetamine on federal property, that is also barred. So you will not be able to get the services. And this is all coming from HUD. You do have to be a citizen to qualify for permanent supportive housing services, and you have to be chronically homeless. And that, again, is the HUD definition. So if the clients answer the questions and they get through the process, the next thing that the pre-screener will do is they will ask the client to email their records to the pre-screen team. So we have a dedicated email address. So clients are sending things that we need for their application, which is like a ID, a picture ID, a government issued picture ID. We need a social security card. And we also will ask for other financial records. And amazingly, clients are doing this and they are submitting their information via email. And once we get their information, then the pre-screeners are scheduling appointments. We have an appointment schedule, and the clients are coming in to complete their intake packets, which is the apartment application and the subsidy application. Prior to the process we were doing before this pre-screen pilot is our CET team was just mainly going out in the community and working with folks to get through the pre-screening process out in the field, getting records out in the field, and completing intakes out in the field. But we found, surprisingly, this system works well. So our CET team rarely goes out to the field. They are mainly in the office and clients are coming to OSH to complete their intakes. It's pretty amazing. I'm really proud of it. I'm going to show you the numbers and you're going to be amazed at how much more people we can capture in this system. And OSH, I mean, we are way out in North San Jose, and amazingly, clients find a way to get to us to complete their applications and turn in documents. So these are the data we collected. So prior to the pilot, in 1 year, we did 716 referrals and we housed 308 people. Look at those numbers after 1 year. It's crazy, incredible. And we're just really proud that we were able to develop a much more efficient system and to house people much more quickly. Resources. Okay, we're almost at the end of our presentation. So Christina's just going to quickly go through resources.
Well, so I'm back, so I'm gonna go quickly on some resources. So the homeless prevention system, so not only are we, housing people, but we also are trying to prevent homelessness from occurring. So as you can see, this homeless prevention system program provides assistance to low-income families and individuals who are at risk of losing their housing. So they have to be living here in Santa Clara County. It provides financial assistance, legal support, and case management and other services. So in order to get these services, just call that number or they can email. Some things that, in order to qualify, again, you have to be in Santa Clara County, low income, current house. But if you are at risk of losing your housing, please call, apply, and they'll give you all the information that you need in order to be eligible. And then the other one that's new for us is the Here For You. So that's the number. So this one will connect to shelter and temporary housing. So you call this number, right to shelter once matched. If there's any housing problem solving, they can help you with the conversations. They can give you options to think about. They can also send referrals to other resources, and some of those, it will be in the other slide. And it's also a connection to homelessness prevention system or victim services providers such as DV and others that will better fit your situation. And then this is the other one. It's a little small, but this is our emergency assistant network. So we connect with different programs such as one here familiar here in San Jose, Sacred Heart. They provide services for individuals. They provide food boxes. Yes.
Sorry, on the previous slide, someone asked if you can please provide the contact for the first resource.
You'll get the slide. You'll get the slides. Thank you, Angelica. You'll get the slides. The number is there, but if not, please email us and we can get that to you. For this, again, they provide food boxes. Some of them have a closet for you. They also do financial assistance. You also get case management, voluntary case management, and each one of these also have other programs that you can do, such as HEAP or PG&E for your clients. And the good thing about this is that not all these programs, a service provider has to do it. An individual can actually go there and ask for services. And then these are the participant agencies that are connected to HMIS. These are in programs that people can go to have their VI spit done. And it's a long list. Oops, sorry. So, yeah, so I'll bring it back to another question.
Sorry, I have a question. What if an individual lives in a different county, but is moving to Santa Clara County?
Now, bring it to me.
They have to live in Santa Clara County to get services here. So they have to be actually residing here.
What about the homelessness period though? So like, for example, if they were homeless in San Mateo for 6 months, then came here and were homeless for 6 months in Santa Clara, that counts?
Yeah, so the question was, what if somebody is homeless in other counties? It could count as long as we could verify their time being homeless in other counties.
I have a question about animals. What about, are people able, or can people qualify for the program with an animal?
So all our properties have a no pets policy, but if a client has an emotional need for a pet, then they can get assistance in getting emotional, what is it?
Or reasonable accommodation.
A reasonable accommodation to have an emotional support pet. So it's possible and people do it, but you do have to, get the letter and go through the process in a legitimate way.
Thank you.
Yes.
So I currently work at the Downtown Youth Wellness Center, and we are wanting to be on that list. HMI participation agencies. And so what is the process for an agency to be able to provide services, to be able to do the on-site views for that?
There is information on the main page of HMIS. If you scroll on the bottom, there's a section asking if you want to be a partner agency, and then you hit a link and it will put you through the process on how to do that. Because that would be very important for the work that you do.
Any other questions?
Well, thank you so much. Okay, so thank you, Angelica, Christina, Christine, thank you so much for so much information, so it was incredible, so thank you. And thank you all for your great questions. I just want to remind people that we have 2 more coming up on June 28th. We have our adult and older adult cross systems initiative. That's on June 28th, and on July 12th, we're going to have our LGBTQ+ services presenting as well too. All right, so once again, thank you. It was so wonderful. Thank you very much. Thank you for everybody here, and